I've been in healthcare for longer than 27 years, believe it or
Very
not.
nice.
Yes, and
You don't look old enough.
yeah, but I am. Don't tell anybody.
Hi there. You're watching The Light of Care, the podcast about our company, FirstLight Home Care of San Francisco and the Peninsula. Our goal is to provide comfort, company, and respite care to elders in need. The podcast we're doing aims to educate seniors and their families about the resources and support available to help them live well and age with confidence. I'm your host, Lynn Carteris, and today I'm here with Elsa Rodriguez, the administrator of Brookside Skilled Nursing Facility in San Mateo. We'll talk about what makes skilled nursing unique, how families can choose the right facility, and the ways staff work to ensure both health and happiness for every resident. Welcome to the show, Elsa.
Thank you
How
very
are
much
you?
for having me. I'm doing great.
Excellent.
Hot but great. Today is a sunny, beautiful day as usual in San Mateo. So
I know, we're very, very lucky.
yeah.
But let's first start with your background. So tell us about you.
I was born and raised in El Salvador. I graduated from college. I was working, at a bank. I came here to the United States, and then I didn't know that the skilled nursing existed in the United States. We take care of our elderly at home. We do everything that we can, as a family together to provide the care. Suddenly, I start meeting people, and they're telling me about boarding cares. All people go to nursing homes, and I'm like, what is this nursing home? So I'm started, curious about it. And then I realized that I could do a lot more for the seniors, and because I felt bad. My parents were not here. They were back in El Salvador. So I felt that there was a need for me to get involved, and I started as a certified nursing assistant. I've been lucky through the many years I work in healthcare that I have found amazing preceptors that have pushed me to growth and continue. And then that's how I got promoted to this role and to this role and to this role until I met this amazing administrator, and he goes, "Why you're not becoming an administrator? You have done everything, in the healthcare. I can be your preceptor. I can be your, and I said, mentor. Yeah. Let's do that. Let's submit the AAT program. And that's how I become a nursing home administrator. And I realized that the changes I can make through being a leader are much, much, much stronger and better than actually doing the care.
So tell me about, first of all, explain what a skilled nursing facility is.
We're able to provide a highly acute level of care that a lot of patients cannot get at home. They cannot get that on an assisted living. They cannot get at a boarding care. So our acuity is much higher. And also, we are required to have licensed staff. Licensed staff means all of our staff needs to be certified. That includes certified nursing assistants. They are the ones who do the day-to-day bathing, toileting, assisting with feeding. Then we have the licensed vocational nurse. They all have to be licensed as well. We have registered nurses 24/7. And we also have rehab services like physical therapy, occupational therapy, speech therapy, nutritional services. So there's a lot of more complex cases that we manage.
A skilled nursing facility isn't something that you just put your family member in. It's generally from a hospital after a stay or surgery or whatever they've had done at the hospital. The next step is to go to you.
Yes, usually you have to have a clinical necessity to get into a skilled nursing facility, right?
Exactly.
And then depends. Some patients, we can admit patients directly from home as well, but it rarely happens.
Yeah.
And that usually is a little more extensive and requires a doctor's orders. It requires a little bit more time and efforts, but the majority of our residents come directly from the acute hospitals because they feel that at the point in time they're not ready to go home. They require the 24-hour pain management, the IVs. They have wounds that assisted livings or home health cannot manage.
Yeah.
So that transition, from acute hospital to skilled nursing, it makes a big difference on the recovery of a person.
Do you have hospice ever in your community?
Yes. So we had the 3 levels of care. We have the skilled nursing. Those are the residents that come directly from acute hospitals. All they think about it is, give me therapy, get me out of here, right? Their focus is to getting better. with occupational therapy, physical therapy, and speech therapy. We have the residents who live in our community because that's their home. Brookside has become their home. We have residents who've been there for 10, 15 years.
Wow, okay.
Because their level of care, it's very high, number one. And financially, it's impossible sometimes for families, even though if they want to keep their loved ones at home. It's very expensive.
Oh, we know.
And then we also offer hospice care,
Okay.
inpatient hospice.
Okay.
So we do have those 3 levels of care within our community.
So back to my question, what's your day-to-day look like?
I never plan for my day, to be honest with you. All I know is that I get in my car and I know that I'm heading to Brookside.
Yeah.
And as soon as I get to the door, I'm like, I'm there. Whatever is going to happen is going to happen.
You're going to handle it.
Because it changed.
Every
It
day.
changed every single
Yeah, of
day.
course.
I'm not an agenda person. I'm just like, everybody tells me, oh, but you didn't write it down. I said, it's going to happen. And even if it doesn't happen, we'll make it happen the next day.
Yeah.
But one of the most important things is that I always do is that I do rounds. And I go meet my residents. If I don't do rounds in the morning and go and see some of my residents, then my day is incomplete. And from there goes staffing issues, phone calls, doctors.
Right.
I mean, you name it. You're like, but that's the life that I love,
That's
and
right.
I wouldn't change it.
Yeah. So what's a typical day for a resident?
We try to individualize care for our residents because what you like, I might like. You might like green, I might like purple, right? So we try to make their activities, and individualize their care plan, which is what we describe, their day-to-day activities. But therapy is very important because we had doctors order that they had to receive therapy so they can go home. Medication is very important because we have a specific times about when to give those medications, showers, etc. But we do offer different activities for them. For residents who are very low actively, they do sensory programs. We have a nail salon where the ladies can go get their nails. We have bingo. If a nursing home doesn't have bingo, there is not a nursing home or a skilled nursing. I tell you that.
What are some of your biggest challenges?
Teaching compassion and caring, you gotta have it within, right?
You gotta find people like that.
You gotta,
it's not teachable.
Yeah. So it's the constant, of letting people know that this is not a profession. The moment you enter healthcare, it's a vocation, right? You really want to do it because it's rewarding. Healthcare has become, pretty challenging, and it's not easy though. I mean, I understand that, especially because I've been working through all the levels of the different staffing within skilled nursing. Mm-hmm. So I understand kind of where they're coming from. Mm-hmm. But at the same time is, trying to reminding them constantly that we're in the business of caring for other people.
If a family has a loved one that needs this skilled nursing that may not be coming from a hospital, what would you advise them to look for?
If you're not in a rush to find a place for your loved one, go and visit different skilled nursing facilities. Don't make appointments. Because just go in because a skilled nursing facility should be able to show you around.
Yes, right then and there.
No, it's not that you're going to start wiping and lifting the carpet just because somebody's coming. You're supposed to have your room clean every day, no matter what.
That's right.
So, and then and look for seniors advocates, places where you can get assistance, but and go with that, the feeling, that the first impression that you get when you see a place. Mm-hmm. And also, even if you place somebody in one facility, doesn't mean that you're stuck for the rest of your life. You had the freedom of transfer your loved one to a different skilled nursing. You had the ability to communicate things are being run, and the facility had to be receptive to it.
How can viewers or listeners get a hold of you? You can just give a website or...
Yeah, we Brookside has a website. It's called brooksidenursing.com. Okay. They can reach out. They can send messages through the website. My business card is at the front of the facility, and people can call me 24/7.
Well, we're so grateful you stopped by. Really appreciate you being here. Learned a lot about skilled nursing, so I really appreciate it.
Yeah.
And if you'd like to learn more about Brookside Skilled Nursing Facility or find resources for choosing a skilled nursing facility, check out the links in the description. We've got more interviews on the way. For now, a huge thank you to my team getting this podcast ready and putting it out there. For more information, please check out our website at firstlighthomecare.com. Follow us on social media. Don't forget to like and subscribe, and we'll see you next time.